Welcome everyone to the Hemophilia Council of California. This is our first webinar of the year. I'm Lynn Kinst, I'm the Executive Director of the Council, and tonight we are going to be talking about the state of healthcare in California, give everyone an introduction to kind of where things stand. With that, I'm going to introduce Terri Cowger. She's the principal with Cowger and Associates, is a health policy expert, and has been the legislative advocate for the Hemophilia Council.
Thank you, Lynn, for that warm introduction. It's my pleasure to have been with the council for so many years and to continue during this exciting time. So, as we've talked a lot about Cal-AIM and Medi-Cal RX, we thought we'd spend a little bit to provide some clarity for those of you that might be new to all of this and might not really understand, what is she talking about, Medi-Cal managed care? What does that mean? Well, if you look at it this way, Medi-Cal managed care, there's about 95% of all those on the Medi-Cal program in California are in Medi-Cal managed care. There's a smaller portion, mostly those who have CCS eligible conditions. So the children age 0 to 21 that are on CCS, which would include those with hemophilia and von Willebrand, who are either children or young adults that are on CCS, they would be primarily in Medi-Cal fee-for-service. There's a smaller subset, about a third of the CCS kids are in Medi-Cal managed care through what's called the CCS Whole Child Model Pilot. So Medi-Cal fee-for-service is where you go to your doctor and any other healthcare provider, and the services are paid for each service performed. Patient usually has a broad choice of providers in their networks, and the state can create different payment methodologies for that, but mostly the main message to understand is if you're in fee-for-service, you pretty much can go anywhere you want as long as it's in the network. With Medi-Cal managed care, you're a little bit more restricted on where you can go, and the state does attempt to manage the finances of that system of healthcare. But it can also work really well if you can get to your providers and if they're in the system or in the network. So how does managed care affect patients with bleeding disorders? Well, as I mentioned, that smaller subset, so about a third of those on the CCS program, have been put into this new system of care called the Whole Child Model Managed Care Pilot. Previous to that, the council lobbied along with the other rare disease colleagues to keep CCS and GHPP patients out of Medi-Cal managed care. Most of the adults on GHPP are in some type of Medi-Cal managed care if they have that Medi-Cal link, but most of the kids are kept out in fee-for-service unless they're in this pilot. So during the past 4 years, while this pilot rolled out, we've been watching it and we've been participating in the CCS advisory group. Managed care can be successful for our community and it can work for the kids, but we have to remain vigilant and ensure that all of the necessary needs are being met. So, for example, are you getting all of the transportation you need to get to your provider? Is your provider in their network? Are you getting all of the language supports that you need at your provider? Are you getting all of the medical treatment that you need? All of the durable medical equipment? Whatever you need, are you getting it? Because if you aren't, we need to know about it. We're trying to keep a list of issues that come up with Medi-Cal managed care and with the CCS Whole Child Model Pilot. Because as I said, right now there's only a third of the CCS kids in Medi-Cal managed care, but most of the adults in California are linked to Medi-Cal managed care in some way, shape, or form if they have the public coverage. So if the state does decide in the future to fold more kids in, we want to make sure that we're doing it very thoughtfully and that everything works really well in this pilot, because the pilot is supposed to test things, right? And we want to make sure that it's working well. So if any of you hear any problems in the CCS Whole Child Model Pilot, please let us know. Contact Lynn at the council and send us an email or leave us a voicemail so we can monitor that more closely.
We do want to thank our webinar series sponsors, Sanofi Genzyme and CSL Behring. And I know that there will be others added to that as the year progresses. Thank you all for coming. We'll have a great evening and we will see you soon.